So I wanted to talk today about using key informant interviews as part of a comprehensive evaluation strategy. And key informant interviews are interviews with stakeholders and other people that are involved with your program. And so key informants can be program participants, they can be people that work in the area that your prevention programming is working in. They can be people who are implementing programs, people who are working on policy. Basically, anyone who's involved in your prevention strategy can be a key informant. And I think it's important and useful to talk to all of those people, especially to talk to the people that are most impacted by the intervention. I love key informant interviews because the reason why I got involved in evaluation is because I really love to tell stories. And so a long time ago, I really wanted to be a magazine journalist, and I really love to read, and I really love to tell stories. And so in my mind, what evaluation is telling a story about why an intervention or a program worked or didn't work. So I love to hear about people's plans, and then I want to know what happened. What happened? Did it work? Did anything change? Was anybody better off? Were there any unintended consequences? And I feel like I do have a background in data and data analysis, so I feel like the data tells part of that story. Yes, it worked. No, it didn't work. This is what happened. But then the parts that I really want to know are like, why? Why did that happen? Why was that so effective? Why didn't that work at all? And I think that the way that you get that information is through qualitative data. And key informant interviews are a really great way to collect that sort of background story, the story behind the story. And I love to talk to people. I really honestly love to talk to people, and I love to hear what they have to say. Well, in the strategy that we're using right now to evaluate our school-based primary prevention programming, we use key informant interviews at several points. We collect survey data at the beginning of the program, and then we collect survey data on the last day of the program, and then we collect survey data at 1 month follow-up. And to supplement that, we do, I personally do an interview with the program facilitator on the last day of the program, or as close to that last day as I can. Sometimes scheduling doesn't work out. As soon as possible after the program is finished, I do an interview with the program facilitator. And then the program facilitator does an interview with the teacher or the site coordinator at 1 month follow-up along with the 1 month survey data. So it's very important to do that. I would really recommend that folks who are doing primary prevention school-based programming do a facilitator interview, because it has been so incredibly valuable to me and to our program and to the sites themselves to be able to talk and check in with the program facilitator very soon after their program is finished. For me, it allows me to really have an understanding of what's going on the ground, where people can share their successes and challenges right away before they move on to the next site and they move on to the next thing. It's my understanding from the facilitators that it's really valuable to them, because it encourages them and gives them a space to reflect on what just happened before they have to move on to their next program or their next site. And most importantly, it gives us a chance to share stories, and it gives them a chance to talk about success stories that I really believe would not be captured otherwise if we were just asking for success stories at the year-end report. My background's in community engagement, and so I did a lot of work with prevention staff from all of our sites around the state to really do relationship building. So I put a lot of, and I really like to hear about people's backgrounds and about what they're doing and about what they believe in. And what they believe their program is doing. And so I spent a lot of time building those relationships before this started. So we implemented the evaluation plan about 1 year after I started building the evaluation plan. So for that entire year, I was talking to folks and involving them in the process, and they really helped to develop the logic model and the evaluation plan and the tools. And so because they were a part of that process from the beginning, it was significantly less weird for me to then talk to them about their successes and challenges, because they trusted that, first of all, their answers weren't going to result in a change to their funding. I'm the evaluator, so I don't really make decisions about where the funding goes, but I do have input into that process. But I feel like they trusted, they had a better understanding of what evaluation was for, and that we were using it to help them to improve their programs, not that we were using the data against them, or that we weren't going to use it against them. We did have a series of questions that we were asking the program facilitators. I think it was 6 or 7 questions. So it was a little bit scripted, but it also could really change depending on the information that we were getting. So I would say if you're not really interested in hearing what people are going to have to say, then maybe have someone else do the interview, because I think that that really comes across during the interview. So the advice that I would have is to take the conversation where it wants to go, and be open to the conversation going in a different direction than maybe you thought as prescribed by the questions that you have. So open up with kind of a general discussion, how did it go, give people the space to talk about what they want to talk about, and then kind of organically move through the questions. And I think that doing a little bit of reflection with the person that you're interviewing is really helpful. So if you were to say, well, it was really challenging to schedule, just doing a little bit of reflection so that they know that I'm listening to them. It sounds like what you're saying is that you had some difficulty scheduling. Is that right? And that lets people know that you're really listening to them. Asking for clarification and then following up on things that you don't understand really makes people feel like they're being heard. And when they feel like they're being heard in that way, they're much more likely to share, to openly share things with you. Because I think that key informant interviews are a great data collection tool, but they're not only a data collection tool, they're also a way to build community and to build trust with the people that you're interviewing, especially when we're talking about interviewing our partners. So interviewing program facilitators and prevention partners. When we have those interviews and we're able to really talk about what's happening and they feel like they're freely able to share their experiences, including their challenges and what didn't work as planned and what they're struggling through, I think that does a lot for building trust that can really help them with their program implementation. For example, it's really important for them to be able to openly share their challenges and not be concerned that we're going to, as a funder, we're going to judge them or penalize them in any way for that, but rather we can hear their challenges and then brainstorm with them ways to overcome them. One of our sites, so I mentioned we do a pre-test and a post-test survey. It's 9 questions, and sites were doing this in middle school and high school. New Mexico has struggles with low literacy for students in a lot of places, and so when I talked to one of the facilitators, he shared that it was really taking a very long time for the students to fill out the survey because it was taking them a long time to read the questions. And so I heard that, and I was empathetic, but still like, okay, well, we still need to do the survey, but thank you for sharing that. And then I was doing an interview with a facilitator at a different site in a different part of the state, and one of the questions is, were there any barriers to evaluation? And he said, no, it's fine. And I said, well, do you have a problem? Does it take a really long time for students to read the surveys? And he said, oh, I read it out loud. And then it goes really quickly, which was such a simple fix. So then that was an aha moment. I was able to take that information back to site A and say, this is something that another person does in a different part of the state. They actually read the questions out loud. Maybe you should try that. Maybe you want to try that in your next session. And he did, and then it went much more smoothly for the rest of the year. And so I don't think that I would have captured that information if we had not been doing those interviews regularly and he wasn't able to share the challenges that he was having with me. And then it was fixed, and then it was much better. So in terms of evaluation, it wasn't only kind of a year-end data collection tool, but we were able to use the information for continuous real-time program improvement. And that happened probably in 5 or 6 different instances throughout the years with different challenges that folks were having, which then further built trust with them because they were sharing their challenges and I was able to help them overcome those challenges. So it was really helpful for continuous program improvement and kind of supporting the sites. But it was also really useful to get success stories. By the time the interview was finished, they would voluntarily share that during the "Would you like to tell us anything else" section. So they would say, "Oh yeah, I wanted to tell you that after the session where we talked about relationship violence, I was walking down the hall and I saw this couple that went into that was having an argument, and they went into a classroom together. And they came out and asked the social worker if the social worker would come help them because they didn't want their argument to turn into a fight," which is something that they had just covered in their session, the difference between an argument and a fight and how to be able to have a productive argument that doesn't turn into a fight. So one of the students that was involved in the argument asked for help, but then also a senior was walking by and offered to mediate, who had also just finished the program. So I think that our prevention partners are really busy and they're trying to run from school to school and they're trying to do a lot of different things. And I feel like those stories would just be lost if we weren't having this kind of regular check-in right at the end of that program. And I love hearing those stories. Those are really important to the health department. They're really important for when we need to share evaluation data with CDC. They're really important when I need to report to my bosses and the people who are making funding decisions, because people love to hear stories. They're much more interested in stories than they are in data most of the time. And it's difficult when you're asking your partners to just come up with success stories at the end of the quarter or the end of the year. But when you're talking to them and they can share these sort of little vignettes, that really paints a picture of what you're doing. I really like that a lot. So all of the components of the evaluation for each site I would keep together. And then when it came time to do their evaluations for the year, I would read through the site coordinator interviews and the teacher interviews and the participant interviews, which were collected. They were more of a roundtable discussion that was collected at the end of the program. But I would read through those and try to identify common themes. I use NVivo for some qualitative data analysis when I'm able to, which pulls out words that were used more frequently than others. But mostly, I would read through it for common themes. And so kind of the nuts and bolts of that is that we had 6 questions for the facilitator interview. So the first one was, what were the successes of implementation? And so for each program, I would go through and copy and paste the successes, for each question, and then look at what kinds of themes emerged for successes, challenges, evaluation problems, anything unexpected that happened, any unintended consequences of the evaluation, things like that, and just look for things that jumped out for me, and then summarize that in a paragraph for the end of the year report for each site. But the success stories I would pull out kind of separately. I would usually remember them, and then when an opportunity came up to share stories, I would remember, that one site or another had shared a really good story with me, and then I could go back and read through what they said. So it was definitely cumbersome. We collected a lot of qualitative data during this year. This was the first year of our statewide evaluation that was consistent across all sites. So this was really a pilot year for our evaluation. I ended up with a lot of qualitative data that I wish I had more time to more thoroughly analyze. I could go to town with just all of that qualitative data. So I think that as time goes on and we're able to drill down a little bit deeper, we'll have even more information that we can use. But in the meantime, there were definitely some clear themes that emerged from kind of a macro level. When I asked folks about the successes and challenges of evaluation, common themes came up that we were then able to address. For example, we had one question on the survey that said, I would never have an LGBTQ friend. And the response set was, I don't agree to I agree. And so the kids didn't understand it was a double negative. So the kids didn't understand, so I would not never, if I would, how do I say I would not never? And that was really confusing, and it was really confusing across all sites in all areas of the state. And so that was really useful to me to be able to identify which parts of the evaluation needed tweaked and to be able to say, we need to change this language here, we need to change this vocabulary here, we need to eliminate the double negative here, and things like that. So I come from a community psychology background, and as I said, I worked in community engagement. And evaluation has really changed, I feel like, over the last, I'm not sure how long, several years, to where it really was about performance monitoring and data analysis to be more of a participatory process and more of a process that involves communities. And I think that, and this was the first time as an evaluator that I had really been able to see that process from the beginning to end, where I was able to design the evaluation, get it through a full year of implementation, a full year of evaluation, and end up with a statewide report. And so having gone through that process really taught me that all the things that I had learned about evaluation and all the things that I believed about evaluation, which is that it needs to be participatory, community members need to be involved from the beginning at all stages, and that the evaluator needs to be flexible in terms of how and what kind of data you're going to be able to collect. That was really important, and I think that what we accomplished in New Mexico was to do a consistent, comprehensive statewide evaluation where all of our sites who were all implementing completely different programs in completely different communities use the same evaluation tools. And now we have a really rich set of data for a whole year from all of those different sites, which I think is a significant accomplishment that I don't think we would have been able to do if we didn't really authentically do the work of listening to community members, making them feel involved, making them feel empowered, giving them a voice, asking them what they needed from the evaluation, and really thinking about, at the end of the process, what they were going to get out of it. And being able to share with them what we were learning while we were collecting it so that they could really see the value of evaluation to be able to improve their programs. Also at this point now, when we have all the data, asking them what they need from us to be able to get additional funding, to share with their funders, what's going to be useful to them, if the reports are useful, and sort of what they need. I think that was so valuable, as opposed to the way that I think some people think about evaluation, which is we're the health department and we're the man, we need to collect this information and then decide where your dollars need to go. It takes a lot of time, and it can be difficult to do all that work up front, but it saves a ton of time, and I think in the end it makes a difference between a successful and a not successful evaluation project. So, teachers didn't really want to fill out a piece of paper with their impressions of the program, but when the facilitators were able to get them on the phone, they were quite willing to talk about their changes that they had seen in their school climate, what they thought about the program, if it was appropriate, and things like that. So I think the takeaway from that is when doing teacher interviews, it's a lot easier to have that personal contact with them. Or I think it's important for an evaluator to do the background work before they start evaluating a program or an initiative, to really make an effort to understand that program or initiative, and really let people, because the sites that we work with, the prevention partners that we have, were really invested in their programs, and they had spent years and years developing them and honing them, and in some cases evaluating them using their own tools. So they really believed in their programs. And I think that it's important for an evaluator to take the time to allow people to talk about that in their own words, to talk about why they believe in their prevention strategy, how they got to where they are, what's on their mind in terms of changes. And it really makes people feel like they have a voice, and they're understood in what they're trying to do. And sometimes it's difficult to understand what people are doing or why they believe in their prevention strategy or even what the program looks like. I don't feel like I had a really good understanding of what a lot of programs look like until I did the key informant interviews and started to hear about what people's experiences were. But I think that really helps a lot. Allowing people to talk about what they're passionate about in their own words does a lot for community building and trust building. I just really see evaluation as telling a good story. And so at the end of the day, if you don't have all the pieces that you need to tell that story in a complete way, to tell a really compelling story about, then we did this, and this is what happened, and this is why, and that's why that didn't work, and people suggested this. Like, if it's not a good story that you would want to read, you probably need to collect some different data in a different way. Don't be a boring evaluator.